good morning and good evening to all of you in India. My name is Admiral V.K. Singh. I'm a doctor by profession, heading the Navy Medicals in Bombay before I took over other things and quit my uniform. I have started International Institute Health Management Research in Delhi as a founder director, and after that I decided that I should be really into the healthcare innovations and try to do that. Published 3 books in USA, and the first one got international award and got Indian edition adopted by IIM. I am thankful to the CAHO, which I am really considered as a part always. Dr. Vijay has been always very close to me, and the good job is being done by the CAHO, Dr. Vijay, and the people around. A word of caution I would like to give. I was here only 2-3 days back in Columbia University, and ultimately found 250 odd innovations are being incubated. A word of caution when I teach in IIM and IIT, I would like to give that what you have done till now, till today, your presentation, is only half job done. After that, if you really want to monetize or otherwise, out of the total, the success rate is not more than 15%. It is that 15% which will come up. The 15% is the one which you should consider, and the people always do, but do think of your failures, and those are the 185 odd percentages. You must learn from the failure. I would now get back to the presentation part of the presenters. It is something which really I congratulate all 5 of them who have come all the way, and CAHO has already selected them for doing. Next for innovation is by the team, Ganga Medical Center and Hospital Private Limited. It is employed work portal.
Good evening all. My name is Radhakrishnan. I am IT lead from Ganga Hospital, Coimbatore. Here I would like to present you a novel implementation of an employee app to facilitate a real-time and better communication between the departments. To sort out this communication gap, we developed a mobile app called Ganga Namathe Employee Work Portal. So Ganga Namathe means our Ganga. So it is an in-house developed application. So it is an integrated with our hospital information system, that is HIS. We used open source technologies like Android Studio, .NET services, and APIs. So the problem we faced was long waiting time for discharge. So discharge is a complex process where multiple departments are involved. So there were no effective communication between guest relation officer, housekeepings, maintenance team, AC, plumbings, and electrical departments. This has led to longer waiting time for next admission patients. If a patient gets discharged, there should be an effective communication between GRO and billing team, typist, and all other ancillary departments. The telephonic communication and HIS entries were not made real time. So there was increased waiting time for the patient to get the rooms. So the other communication gap, every time the guest relation officer has to access a desktop computer for viewing the status about the bill, discharge summary, and room status. So every new patient check into the room, the GRO must go to the patient room and explain about patient rights, responsibilities, and hospital orientation. Sometimes guest relation officer visit immediately or within an hour. Sometimes they skip this activity. Sometimes they may visit later. So sort out all those communication gap, we introduced Ganga Namathe app, that is employee work portal. So these are some screenshots of the user-friendly mobile app. The access control defined for each user category based on their role. So this is an inpatient list. Current status of all rooms can be viewed on the same screen. In this screen, each patient tab shows details about primary and secondary care provider details, room number, current status, date of admission, and date of discharge. Once we click this patient tab, we will get the status of the patient when they were admitted, room allotted, discharge request raised, bill process, and bill completed. Also, discharge summary completion time can be viewed. So this is the room cleaning status screenshots. After the patient checked out, the respective team, that is housekeeping, AC, plumbing, and electrical department, will get an immediate notification in this mobile app. So the respective department person will reach the room earliest and do their work. After completion of their work, so they will update complete status in this app in real time. The room clean status screen can also viewed by guest relation officer, room allotment desk, and other heads. So in real time, everyone will get to know the status and allot the room to the next patient immediately. So these are the additional features like checklist for guest relation officer. So easily we get to know when the guest relation officer met the patient after patient checked in. So notifications are also available for guest relation officer, bill process staff, to get immediate attention about discharge requests, so that they will start bill process work immediately. So also we have housekeeping rounds checklist, vital entries, and remote registration screens, the same app. So here I would like to present data before and after implementing the app. There was only 10% adherence to the target discharge time of 12 p.m. After implementation of this app, we improved up to 40%. So here this charts shows on-time discharge percentage before and after implementing the app. The cumulative time saving per month was also huge. We saved more time. So now we can able to check out most of the patients before 12 noon or at least before 2 p.m. So thank you. Thank you so much.
Thank you very much, Sir Radhakrishnan. And this is something which really very good you have brought out. I would like to mention three things here. Something is that what you have brought is very good, that the discharge time all over the world takes much more than the admission time. So at least you are able to track it down.
It's in real time.
Lots of, it is something when for any person who is in the wedding coming, it takes, everybody looks after. Once sanction is over, nobody bothers about them. So is that. Second one is that everyone, when you do any innovation, which I'm glad you have done, should be why you're doing it. It may be technology fellow, it may be IT fellow, it is just to look after the patient, optimize his requirement, and also bring down the cost and improve the efficiency. So that is what you have also looked into, and I'm glad that is it. I'd like to also mention my last here, that innovation does not require qualification, experience, it requires ideas. That's why Ideathon, Hackathon, which we have done it at national level, is done just to pick up the ideas and then you mature them. I published an interview of a young boy who is in 9th class, who's got national awardee, and he's developed 3 of that. He's from Jammu, place like a small place, not so known for it. And he's the one so confidently presents and does it. He's not, he's just a 9th class boy. So that is the culture we are looking for, that people should be into innovations, and it's taking it up. Anyway, thank you very much. I now thank all the 5 teams. They have done a wonderful presentation, work, and in something which has been brought out